Great. Thank you, Julian. Appreciate it. First of all, I'm Maria Pesqueira, President of Health Community Foundation, as Julian has mentioned. And I want to mention, as we have quite a number of you who are in attendance, I think this shows the interest and the urgency in the topic. And so it's we Zoom and webinars function. We have this many folks change a little bit, so please bear with us as we go through this process today. But first and foremost, let me share my gratitude to everyone who's made today's webinar possible. Thank you to 3 of our grantee partners, Shriver Center, Legal Counsel for Health Justice, and Healthy Illinois campaign for leading this important presentation today, and for your ongoing work and advocacy on this topic. I also want to thank our partners at Health First Collaborative who've shared information about Medicaid redetermination and have partnered with us today to help bring information to you all. And of course, thank you to all of you who are here to learn more about this topic. We're happy to see so many of our grantee partners, community partners, peer funders, staff of elected officials in our area and across the region in the Chicagoland area. So we're really pleased. Thank you very much for being here. The pandemic upended several aspects of our lives and early on, and we faced so much uncertainty, especially in how we could be and stay healthy. For the past few years, when it comes to Medicaid coverage, people have been able to stay insured without the need to re-enroll each year until the end of the COVID public health emergency. This has allowed individuals and families to keep their coverage during a time when access to health services has been needed the most. In fact, we saw Medicaid enrollment grow and the uninsured rate drop in Illinois during this time, especially for children and older adults. Unfortunately, the pandemic is not over, and the end of the continuous enrollment provision is quickly approaching, putting hundreds of thousands of people in Illinois at risk of losing their coverage, especially in BILPOC communities. As a health conversion foundation, our mission and vision are rooted in ensuring that all in our service region can lead full, healthy, and happy lives, regardless of who they are and where they live. And so we are invested in helping spread the word along with all our partners about Medicaid redetermination and what needs to be done to keep people covered and healthy. Thank you once again to our presenters for your attention to this very important information. I'll now pass it over to Stephanie Altman from Shriver Center, who will kick us off.
Thank you so much, Maria. And thank you, Julian and Stephanie Campos and everybody for getting this webinar together. And sorry about the cameras. We'll do some troubleshooting, but you're able to see me and Stephanie Campos. And during the webinar, all of the slides will be up. So since we're screen sharing, if my colleagues can't get on camera, you will hear their lovely voices as soon as we turn to them. So I'm going to start us off, and this is an information session about, as Maria and Julian have pointed out, a very important issue that is now coming to fruition as our COVID health emergency is waning, and we want to give you as much information as possible about it and what you can do. We will have, please, as I said, put questions and answers in the chat or in the Q&A, prefer the Q&A. We will try to cover everything at the end. And if we can't, we will get back to you individually and get that information for you. So I'm Stephanie Altman. I'm the director of the healthcare team at the Shriver Center. My colleagues, Carrie Chapman, legal counsel for health justice, Tovia Siegel at the Healthy Illinois campaign, and Andrea Kovach are all presenting here today. So we're going to give you an overview of what the public health emergency is. Why is it significant? Why is the ending of the public health emergency have anything to do with Medicaid? What is the process for the Department of Healthcare and Family Services, which we call HFS, try to be good on the acronyms today, to begin doing renewals, which are called redeterminations again. What can you do as staff at organizations and leaders and foundations to try to help in this process that's going to happen over the next year? Specific impact on immigrants, because our immigrant communities have some very specialized impact in this process, and we want to make sure that we reach them. And then we're going to give you lots of resources. There's lots of links in the slides, and have time for questions. So first, an overview. So the public health emergency actually was declared on January 31st of 2020. It's very hard to believe it's been more than 3 years. The end of the public health emergency at the federal level, the sort of official designation, is going to end on May 11th, 2023. We know that's not the end of COVID. People are obviously still getting infected and need care, but the rules and the laws and some of the flexibilities that were put in place so that we could, as a nation, respond to this public health emergency that was unprecedented, many of them are going to end on May 11th. The most important flexibility or part of the public health emergency for our purposes here that we're talking about today, there were lots of authorities to change things like licensing of providers, telehealth, very important flexibilities. But today we're going to talk about the suspension of terminations of Medicaid. So on March 18th, 2020, so about 2 months after the public health emergency was declared federally, Congress and the federal government and all of the states were directed to stop renewing or redetermining or looking at the eligibility of current Medicaid enrollees, as was the annual process since the beginning of time, in order to make sure that people were covered continuously and didn't lose their health coverage during such a vulnerable period. So on March 18th, 2020, for instance, Illinois put out their guidance and said, no redeterminations will be held that would result in a termination. So unless a person said, please take me off Medicaid, I don't want to be on Medicaid anymore, they were deceased, or they moved out of the state of Illinois, they could not be terminated from Medicaid. Their Medicaid could not end. Were there some mistaken terminations? There were a few, but there was no legitimate reason that anyone should have been terminated. This is generally referred to as the continuous coverage provision. So annual reviews of whether you're eligible for Medicaid anymore are required by federal law. You have to renew your coverage normally every year. Different states call them different things. A lot of states call them renewals. In Illinois, we refer to them as redeterminations or readies. A lot of people call them my readie, but they are increasingly using the language renewal. This was suspended during the public health emergency unless someone could just be automatically renewed as eligible. So that's called an ex parte redetermination. I don't remember what ex parte means in Latin, but basically it means without the person having to do anything, you're just automatically renewed, and get a letter saying, hey, you're still eligible, checked all your data that we could find, you're going to stay on. So as many people as they could, the agencies renewed them during the last 3 years so that they didn't just wait around for everyone to be renewed when the public health emergency ends. This includes most families and individuals who had SNAP, which are the food benefits, because SNAP did go through redeterminations. So very intelligently and smartly, as long as the agency was looking at your SNAP eligibility, let's say 6 months ago or a year ago, they have all the information they need to renew your Medicaid. So just went ahead and automatically renewed it. We think over 60% of the people have had their automatic renewals, and maybe it's even higher. I can let my colleagues weigh in on that. But that leaves a significant amount of people who might not have been eligible for Medicaid anymore, or have, when even their income was checked or things were checked, the state couldn't tell. They couldn't tell enough to just automatically renew them. So instead, they were just suspended, just kept on Medicaid, not renewed. And that's what's starting again, is to do these redeterminations and renewals, especially for anyone who hasn't been renewed in the last 3 years. So regular redeterminations or renewals are now restarting. The first group of these letters that will be mailed to and emailed and online, if people have online accounts, are to arrive by May 1st. So we're very close. This is, again, only for recipients whose coverage is due to be redetermined by June 1. So everyone's redetermination date is different. Pre-pandemic, you were redetermined once a year, and it followed your timeline. So it's April right now. Pre-pandemic, if I applied in April, or even right now, April 2023, I applied, I got Medicaid. My renewal date would be a year from when I got on Medicaid, and it would follow that, not like a calendar year, like your insurance. So now we're going back and redetermining people who haven't been. And so they put them, HFS put them back on a schedule that is in keeping with their original schedule from the beginning. So that is having over 14 months or the next 12 months, 12th of the population, but it's actually because of the timing goes over 14 months, will be redetermined each month. Not every state is taking that whole time to do it. Illinois is doing the most flexible, the most liberal that they can be under federal law, and taking the longest amount of time to renew, doing it as slowly as absolutely possible so that everyone's not renewed in 1 month, which would be real chaos. So for people who normally their calendar year would be June 1st, they are going to get a letter by May 1st. They have to answer that or complete and sign the form, or do it online or do it by phone. And we'll talk about that, all the ways they can do that. But they do have to do something within 30 days. They can't be, they're not just automatically renewed, because we know the people who are automatically renewed, they're continuing to do it. These are people who the state needs some information from. If they don't respond, and let's say they are still eligible, but they don't respond, they didn't get the mail, they didn't know what it meant, it didn't come in the language they spoke, or any of a host of different reasons, if they have failed to renew, the first date that those people could actually lose real medical coverage, their Medicaid card would no longer be active, would be July 1st. This will then continue over the entire year. And I know someone asked this in the registration. Like I said, if somebody applied in 2023, then they're just now on the regular schedule again. Like I applied this month, got approved, I'd just be April 2024. So after a whole year, plus all the people this year, we'll just be back on our 12-month schedule. So what is it that recipients and enrollees need to do? If they get a letter in the mail or they get it on their online account, they need to renew their coverage. The absolute best ways to renew that is online, and we'll talk more about the online way to renew your coverage, but not everyone has an online account. By fax, because that goes to a central scanning unit that has a barcode on your form and it can get right processed. By phone, there's phone lines that will be able to do this. You also can renew in person or by mail, but just yesterday, actually, Healthcare and Family Services has been doing a lot of trainings on this. They said they really discourage the return of these forms by mail. It's the least reliable, or in person, especially because you really need that barcoded form to be processed and scanned. And while the office should be turning that form over to the central scanning unit to get scanned, or the mail should be processing it, that's the most delayed, way to do this, the least efficient way. So again, just an example timeline, the first dates any recipients could be lose coverage because they're no longer eligible. Maybe they're not eligible for Medicaid anymore, or they are eligible, but they failed to renew, would be July 1. There is a reinstatement process, so they can be reinstated if they do the reinstatement and complete their redetermination paperwork. And we're not going to go into super detail here like we do in our trainings for people who are helping people fill out these forms. This is just to give you an overview. But they can be reinstated retroactively to their termination date and then have no gap in coverage But, it can take a little while to get reinstated. So it's not, first thing, the best thing possible is to not lose any coverage and to get your form back on time and to just stay on. But they can be reinstated. If it gets past 90 days, they would have to reapply. That's where we could see some delays, and they can ask for 3 months backdated coverage, but they might lose a month there if it's been, now 4 months. What are we doing? So the whole state, many partners, the state agencies are really gearing up to get the word out through earned and unearned media. You may have seen articles in the newspapers. They're doing texting campaigns, mailings. We've met with state agencies just yesterday about what kind of in-person events they can do. There are toolkits in 63 languages. The Healthcare and Family Services is announcing this week that they are going to do a 3-part recorded training series for all professionals on this. That the dates they've said, I don't think we have them out in writing yet, but they told us are April 19th, April 27th, and May 3rd. And we will be posting all that information, and they will be recorded. Those will be deeply detailed, in terms of here's what the form looks like. Here's exactly what you do. They are working with managed care organizations, which cover much of the population, to give them lists of when their enrollees, when a managed care organization who organizes and takes care of managing the care of Medicaid recipients, will be able to look at lists of when are my enrollees' renewal dates, who's coming up in May, who's coming up in June, who's coming up in July, and do outreach to them, as well as FQHCs, partner social service agencies, and hospitals. All of them are really reaching out to their clients now, and have been for a long time, saying, update your address. Most important thing, update and make sure that your address is correct with HFS. And now you can check, when is your renewal date coming up? Because it's a little hard with the messaging when there's all this news, hey, redeterminations are starting again, and it's not all happening in 1 month. You may not be until 7 months from now for your renewal. And we see even national news getting this wrong. I just saw, even last night, there was another, kind of tweet from New York Times or a national news saying, all these people are going to lose Medicaid in May 2023, which isn't really accurate. Some states are doing it quite fast, but it's still a process. So who's monitoring this, and how are we going to keep track of what's going on? We're doing some monitoring here at Shriver Center. The Legal Assistance Foundation of Chicago is tracking their clients, many social service and legal organizations. We're holding community events, office hours in Spanish and English, where even individuals can get on and talk to our bilingual immigration attorney if there's special issues, but also just about redeterminations. In the notice that was sent to many of you, there's a link, but I put it here too, to Health and Medicine Policy Research Group, who's doing a survey of community-based organizations in partnership with many of the foundation partners here to kind of monitor capacity, to assist clients and keep track of what's happening on the ground. Healthcare and Family Services continues to report. They're required to report to the federal government certain statistics, which they will be publicly reporting from each state on how many people are terminated, how many people get reinstated, to kind of keep track of the process. HFS has a lot of information on their information site. Again, I'm going to check these links again before we send it out to you, because I know they changed their website yesterday. And Georgetown Center on Children and Families and the National Protecting Immigrant Families also have materials, things in different languages, and an unwinding task force. Some quick special considerations that we are looking at and keeping track of, more from Tovia later and Carrie on these, but immigrants enrolled in the new expansion programs, health benefits for immigrant seniors and health benefits for immigrant adults, are going to be having their eligibility redetermined for the first time ever, because their coverage began only during the public health emergency. So they've never experienced a redetermination and may be unfamiliar with the process. And they're least likely to be able to be automatically redetermined. So they're most likely to go through the whole process, have to go through. Immigrants who've been eligible under all kids and moms and babies, the state has kept them on, even though they may be 21, 22 years old, as they've kept all children on, or beyond the 12 months postpartum. And many of them actually might not be eligible unless we expand coverage again in another category. So they may actually fall off. Older adults and people with disabilities have also not had to have their resources or assets checked. And they will need to do this, including people in long-term care. HFS is doing a special training just for long-term care facilities and people in long-term care facilities next week. And people who have income a little bit above Medicaid, including some of the people on immigrant programs, they really haven't had to meet that deductible. There's been no deductible, no spend down is what it's called here, applied to them except for once in the last 3 years. So these are particularly vulnerable populations that we are targeting and doing extra care to make sure that we follow. So the kind of issues that we may see with the whole population, just based on what we've seen, I've done this like 30 years. So just what we've seen in redeterminations or mass eligibility changes in the past, we may see here. We hope we don't, but what we'll be looking out for. Any kind of challenges with timely mailing, people not receiving mail, always a problem. Addresses being not updated. Phone line delays, if people are calling the 1-800 numbers and they're not open for all the hours that people need, after hours, Saturdays, etc., or there's very long wait times. Issues with people perhaps trying to do the redetermination on the phone, but then needing to submit documents to verify income, and faxing or mailing or trying to submit those online. A lot of people may ignore everything. So we always did in the past have very high rates of people either not getting their mail or getting it, not understanding it, or sending it back and the state never getting it, or really not responding at all. And I forget, but I think it's 30 to 40% pre-pandemic would have to get reinstated. They didn't really find out till they went to the doctor or the pharmacy that their Medicaid was cut off. If large numbers of people have to get reinstated, the good news is they can get back on Medicaid. The bad news is it causes a further delay in processing. So the state could get overwhelmed with redeterminations, people requesting reinstatement, and then people reapplying. And what's happened in the past is that could be duplicative. You could have people saying, I requested reinstatement, but I'm nervous, and then I reapplied, and they have lots of duplicative applications, and it could cause some real problems. Confusion due to language access barriers, and then difficulty transferring from the Medicaid to the marketplace, which Carrie will touch on. We don't have a single state marketplace here or a state marketplace like some states like California, although hopefully we will someday, where the transfer is all one agency. So it's a little easier to say, oh, you're over income from Medicaid, here you go to the marketplace. Our transfer is not quite that seamless. So we may see some people getting cut off. And I am going to turn it to Carrie now. And Carrie, I'll keep my camera on and then also move your slides.
All right, fantastic. Can you hear me, Stephanie?
Yes, I can hear you. Sorry, I muted myself.
Sweet. Sorry. No. Okay. Fantastic. And I'm sorry, everybody, that you can't see me. This is Carrie Chapman from Legal Counsel for Health Justice. I've been trying to answer some questions in the Q&A. So hopefully someone can take over for me there. All right. Next slide. So I'm going to talk just a little bit more in detail about the process, although this is certainly meant to be a presentation to kind of orient everybody to the process, but not to actually give you the details that you would need if you were sitting down with an individual and trying to work with them on completing their redetermination. So this is a bit of a flyover for everybody. And to do some level setting. But as Stephanie mentioned, there are going to be lots of opportunities for trainings and recorded presentations and information, so that when folks are actually sitting down with people, you will feel like you have good resources. And if there's anything that you feel like you're missing, as May rolls on, this is a great group of folks to reach out to say, hey, there's nothing on X, Y, or Z, and we'll try to connect you with something. So as Stephanie mentioned, annual renewals are a standard in the Medicaid program and have been since 1965. So it is traditional with the Medicaid program that you need to reestablish your eligibility once within every 12 months. And generally that corresponds with the date that you got on Medicaid, so that you first applied, the month that you first applied. But also because redeterminations pre-COVID were sometimes delayed, it sometimes ended up in another month. So maybe you applied in May and you ended up redetermining in June because the state got a little bit behind. But in general, it should correspond with your Medicaid anniversary date. And there's a great overview on HFS's website of the traditional renewal process. And again, this is going to be an unusual 14 months that are happening now, but really the base of the process is the same. We're just returning to a world in which people have to establish their income and other eligibility for Medicaid. And as Stephanie also mentioned, the state is working and has been to renew people's Medicaid when their SNAP is renewed. So Medicaid and SNAP eligibility are not completely identical, but oftentimes when the state does do a review of SNAP eligibility, they have enough information from the enrollee to renew their Medicaid. And so the state has been doing that over the past 3 years. So they haven't been terminating anybody from Medicaid based on that SNAP income and household membership information, but they have been renewing people. So that might also change your month of renewal, because if you had a SNAP renewal, if you applied in May of a given year, you happen to have a SNAP renewal in August of a given year, now your Medicaid renewal date is going to be tied to that August date. We have also, as Stephanie mentioned, been trying to do ex parte renewals. So if we have been able over the past several years to electronically verify your ongoing eligibility, so verify your income, verify your household membership, verify your Illinois residence, verify your immigration status. We've been able to do that entirely electronically by pinging databases. Then we have, in fact, gone through that process and renewed you over the past 3 years. So it was behind the scenes. You didn't have to do anything, but your Medicaid was, in fact, reviewed and renewed. Again, we didn't terminate anybody, but we did renew people. So the cohort of folks who are literally going to be going through the process for the very first time, whether they realize it or not, are if your information was not able to be verified completely electronically, or if you don't have SNAP, or if you need to have your assets verified, because one of the things that was suspended during the pandemic was verification of assets for Medicaid. And there are Medicaid programs that have an asset test or a resource test. So if you are an older adult, 65 plus, or you are a person with disabilities, for example, you actually have asset as well as income limits for your Medicaid eligibility. And so we have not looked at those assets for the entire PHE. And now in order to maintain eligibility, we will have to look at those assets and review them. Next slide. So you'll oftentimes hear the state and folks like us talking about Form A and Form B. And so we want to kind of orient you to what Form A and B are and the terminology, because you will likely hear these terms again. So Form A are these ex parte redeterminations that, again, we use electronic databases, the Social Security database, the Illinois Department of Employment Security database, to verify all of the eligibility factors for Medicaid. And so if HFS has enough information from pinging all of these databases about a Medicaid participant to automatically enroll them, they will send out what they call a Form A redetermination letter. So there will be a notice mailed. Folks will get a notice, even if they are being automatically renewed. And the notice will say that they don't need to do anything else, and their Medicaid will automatically be renewed for another 12 months. So it will be a notice that they don't have to act on, but it will say your Medicaid will be renewed for another 12 months. The notice will have some information about their case, about who's on their household, in their household, and what their income is. And folks do have an obligation, if that information is wrong, to follow up with the state. So you don't need to do anything when you get the letter, but if the information in the letter is not correct about your household, then you do need to follow up with the state with correct information. So just as a quick example, let's say it lists, that 3 of your children live with you, and now 2 of your children have left the house. They turned 18, they left the house. That changes your household size, and your household size impacts what your income level is for Medicaid eligibility. And so if they're still listed in your household and they're not your tax dependents and not in your household anymore, then you will need to inform the state of the change. Otherwise, you get a Form A letter and you just keep going and you've got 12 months of eligibility. Next slide. Form B is the exact opposite. So this is a letter that is going to tell you that you must respond if you are going to keep your Medicaid eligibility. It will also contain pre-populated information, we hope, for the most part. However, you will need to affirmatively confirm that information and potentially provide verification of your income or your household membership or your status in order to keep your Medicaid. And it's just super important to understand that if you get this letter that says, we need to hear from you in order to determine whether you're still eligible for Medicaid, if you do nothing, you will be terminated. That's what will happen. If you do nothing in response to a Form B, your Medicaid will be terminated. Even if all the information in the Form B is right, and you think, well, it's all right, I'm fine. You are not fine. You must act. If you do not act, you will be terminated. Next slide. So if you get that Form B and you have to take an action, how do you do it? And the best way to do it, the sort of gold standard way to do it, is to do it online through Manage My Case. And the reason that that's the gold standard is that basically you are putting information electronically directly into the system, directly into your case in the system. And so it is the least likely, we really hope and believe, to lead to any kind of snafu or problem. And so you can go into Manage My Case, and there's going to be a renew button, and you can follow the instructions and renew your Medicaid through Manage My Case. And we're talking just a little bit later about getting access to Manage My Case, but that is the gold standard. You are also going to be able to renew by phone. And that is definitely, I think, a way that a lot of folks are going to want to engage in the renewal process. One thing to understand, though, is that if the state needs verification of, that you're an Illinois resident, what your income is, who's in your household, you can't obviously provide those verifications over the phone. Telling them over the phone is not a verification. And so there will need to be some potential follow-up for some folks who call in to do the to complete the redetermination. They will have to send things. And so that leads to the renewal by mail or by fax. Again, I think one of the things that we can do that is one of the most important things we can do is help people have the bandwidth to fax things back to the agency. Because as Stephanie noted, mail is a very poor way to get any kind of information processed by the state. It's just really challenging. And it is likewise going to be challenging to take the forms to your local office. They're still not fully back on site and fully staffed. They've got a lot of DHS workers who have never done a redetermination before, so they have a lot of training challenges there. So faxing is definitely going to be the best way to get information in. And that's something that most of us on this webinar have access to that community members may very well not. And so helping to facilitate that. You can return the form in person to the DHS office. Again, that's not the ideal option, but it's better to have someone do that than do nothing. Because if they do that and can establish that they have taken the form to their local office, then that's at least some proof of they're taking an action. Next slide. So that's sort of a summary of what's going to happen with folks who either get a Form A, yay, you win this year, get a Form B, you may still be eligible for Medicaid, but you do need to respond in order to keep it. But there are going to be a substantial number of folks, as Stephanie noted, who just aren't eligible for Medicaid anymore. They got on through moms and babies, but they don't have the immigration status needed to be eligible for Medicaid. And so when they get a redetermination form, they're going to be determined ineligible based on immigration status. You will get appeal rights, which is fantastic. But appeal rights are really only helpful if you think that HFS has improperly terminated you. So if they think you have more income than you have, or you have a different household membership than you have, then you can appeal the termination. If the person is just no longer eligible, let's say based on immigration status, then appealing is not a terribly helpful thing to do. But some people will be eligible for marketplace insurance. And so we're going to talk just a little bit about that in a minute. Actually, sorry, first, we're going to go back. Summary of next steps. So right now, what can you do? Because the letters don't go out until the end of April and people aren't going to get them till the beginning of May. So what can you do right now? Right now, you can help people ensure that their address is correct with the state. So these notices, Form A and Form B, are going to go out in the snail mail. They will be in Manage My Case if people have access to it, but they're going out via snail mail. They can't get to you if you don't have access to Manage My Case unless your address is correct with the state. So lots of ways to do that, and we'll send that information out. But it's really important that people have their address correct. Find your due date. So HFS is going to make available via phone in an automated phone line when your READY is coming up. So what month you can expect your READY. So having folks figure out when their READYs are, those READYs dates are also going to show up in Medi, which is the computer system that providers have access to. Look there and see when patients' due dates are, and then set up a Manage My Case account. And then let me just look really quick in the chat. Will this include Medicaid for undocumented immigrants? So there are, if you are between the ages of 19 and 41, there is a reasonably high likelihood that if you were on Medicaid, either as a result of being in all kids because you were under 19, or let's say on moms and babies, then when you go to READY between ages 19 and 41, you will no longer be eligible for Medicaid as a result of immigration status. If you are 42 and up, then you may very well be able to redetermine and renew your Medicaid under the health benefits for immigrant adults or health benefits for immigrant seniors, although there are income limits to those programs, and an asset limit for HBIS. So there are folks who will just be renewing, and they may be undocumented, but they still have eligibility. But there is right now going to be a cohort of folks who might have gotten on properly and stayed on during the pandemic who are now no longer eligible. Stephanie, do you want to unmute if there's anything else you want to say about that point?
No, that's absolutely correct. Thank you.
Okay. Next slide. Okay. So again, you can use Manage My Case to verify your address or change your address and check your renewal date. It is the gold standard for doing that. So again, helping people get into Manage My Case, and we'll talk about that, is super important. You can also call HFS to report address changes. This is new. You always used to have to deal with DHS, but now you can actually call HFS directly to report address changes. You can also call DHS. And there is an online form that you can use now to update your address. And so lots of different ways for folks to update their address. Again, I cannot stress enough how important this is. The state still does a lot through the snail mail. If they do not have your correct address, you are undoubtedly going to miss important information. And then, as I noted, healthcare providers who use the Medi system will be able to look up renewal dates for patients. So the state is also engaged for the first time in its history, to my knowledge, in the human services, DHS or HFS field in text messaging. And so they're going to be sending out text messages. This is an example here. So if folks are saying to you, oh, I'm getting text messages, then indeed that may very well be the case. And you can sort of check the language that the state is using to see if that language corresponds to the text that people are getting, to make sure they're appropriate. So ask people to, make sure that their phone numbers are correct, and to give the state permission to text them, and to pay attention to those texts. Next slide. So again, if not everybody is going to be able to renew their Medicaid. So we talk about Medicaid renewal, but for some people, the end of the PHE is the end of their Medicaid eligibility. So some folks will no longer be Medicaid eligible because their income will have increased from when they applied and were put on Medicaid. And if their income is increased and they meet the marketplace immigration status requirements, which this is a hyperlink in the slides when you get it, then they may be able to go to the marketplace to get coverage. And they can actually start an application in the marketplace up to 60 days before the last day of Medicaid eligibility. So if someone's Medicaid eligibility is ending, their income is now way above the 138, let's say, percent of poverty, then they can start the process 60 days before their last day of Medicaid eligibility. So that will be tied to when their renewal date is, but it's predictable, or any time between March 31st of this year and July 31st of this year. So there's a window that folks can go to the marketplace and get coverage. And the marketplace coverage is effective the first of the month following the Medicaid termination. So people should not have a gap. Unfortunately, we think that some folks who are not eligible for HBIA and HBIS may receive the standard form letter from HFS, which is going to send people to the marketplace who are being terminated from the program, and they do not have qualifying statuses. So one of the things that we're going to have to all navigate is that generic notices are going to get sent out that may be confusing or complicated in individual cases. So I think what is useful for us is to understand who may be eligible for marketplace coverage, who has immigration statuses that make them eligible for marketplace coverage, and making sure those folks get there, and then helping people understand who are not marketplace eligible, that their Medicaid termination is not improper, that they are not marketplace eligible, and send them to free and charitable clinics and FQHCs and other spots for care. Okay, so specifically, how are people going to get to the marketplace? Can go to get covered illinois.gov and find out where they can get to an application counselor to get assistance. And these folks will generally also help with Medicaid renewals. But Get Covered Illinois is a great place for folks to go who are properly terminated from Medicaid to see what their options are. And now I'm going to turn it over to Tovia, and I'm going to go on mute and turn back to answering some questions.
Thanks, Carrie, and good afternoon, everyone. Good morning still, actually. My name is Tovia Siegel. I'm the director of Healthy Illinois Campaign, which is a campaign in Illinois, as the name suggests, working to expand Medicaid-like healthcare coverage to everybody in the state, regardless of their immigration status. So I'm going to talk quickly about some of the people who might be left out after redeterminations begin and what we can do about that. So like folks have mentioned already, this redetermination process will impact all Medicaid enrollees in Illinois and across the country, but there are some people who might be particularly vulnerable to either losing coverage or navigating the difficulties of the redetermination process. And some of those people those populations, as mentioned, are undocumented immigrants, other immigrants enrolled in health benefits for immigrant adults and health benefits for immigrant seniors, the new Medicaid-like programs in the state of Illinois, people without a stable address, non-English speakers, right? And as Stephanie mentioned, health benefits for immigrant adults and seniors enrollees have never had to renew their coverage before, so this could be particularly difficult for them. So Healthy Illinois and our member organizations, many of whom are presenters and on the call this afternoon as attendees as well, are working really hard to make sure that Illinois expands coverage so that nobody is left without a coverage option for health insurance, right? And so there are some people, like Carrie mentioned, between ages 19 and 41 who are undocumented or have another immigration status that makes them ineligible for federal Medicaid, such as the first 5 years of their green card and some other statuses, who might have coverage now. Either they had all kids and were able to stay on past age 19, or they had moms and babies coverage during pregnancy and 1 year postpartum, who will lose coverage when they're redetermined because they won't have another pathway to being insured. So that's why we're fighting really hard to expand coverage in Illinois. We have bills in the House and Senate right now that would expand health benefits for immigrant adults to cover people ages 19 to 41 so that we have continuous coverage for all low-income residents in the state, regardless of their immigration status, and nobody is forced to either lose coverage, like some people will inevitably have happen with the redeterminations, or not be able to enroll in coverage in the first place. And I'll just leave off with sharing, we had a press conference a few weeks back where different people shared their experiences with accessing coverage, and the experience of one person who is a DACA recipient and previously had all kids, now has coverage through her university, but when she graduates, because there's no option for coverage between 19 and 41, will no longer be able to access health insurance. And so it's crucial, it's urgent that the state expands coverage for all. And I would invite you, my contact information will be in the slide deck. I would invite you to reach out if your organization or institution is interested in getting involved in the work to expand coverage to everybody.
And we're going to turn to Andrea now. Please put your questions in chat.
Hi, everyone. Andrea Kovach from the Shriver Center here. So we wanted to make sure that you all were aware of some resources that can help you over the next 14 months with assisting folks with redeterminations. The first is Help Hub, which is an online community assistance or online technical assistance portal where enrollment assisters, caseworkers, social workers, financial counselors, staff from organizations that help people connect with public benefits can all register. And we have the link here for how you can register. It is free. And if you can go to the next slide, you'll see that on Help Hub, once you become registered, you can see documents about public benefits in Illinois. You can ask questions about public benefits, either if you have a case that you have a question about. It can be a case about an individual or a general question. This is also where we post trainings. I know many of you asked about trainings on redeterminations. So this is where we'll post trainings from trainings we're doing, that our partners are doing, that HFS is doing, so that you can stay up to date and current on the available trainings. Some of these trainings are in Spanish or other languages as well. And on Help Hubs, questions can be answered in English or Spanish. So we highly, highly encourage you to register. And for funders who are listening, you know, this Help Hub is a great resource to tell your grantee organizations about so that they can connect to Help Hub as well. Next slide. We also wanted to let you know about a community-facing website called getcareillinois.org, which is offered in 5 languages listed here. And this is a great way for community members to get up-to-date information about Medicaid eligibility, about health coverage eligibility through the marketplace as well. And we're adding a specific section that's immigrant facing as well. And that will again be translated into 5 languages. We also wanted to lift up the Immigrant Family Resource Program, which these programs are statewide. These partners offer services in 55 different languages, and they're continuously trained on issues such as public charge, as we've listed here, but also on redeterminations. Next slide, please. Also, we wanted to give you more specific redetermination resources. HFS has been extending the fact that they will do presentations at your events. You do have to submit a couple weeks in advance this request for them to come to do a training on redeterminations. HFS has also spent a lot of time updating their information centers. They have an FAQ that's been posted, as well as the Ready to Renew toolkit, and they're going to keep adding resources as well. And then federal CMS also has a toolkit on redeterminations that provides a really great overview. Next slide. So that concludes our presentation. And again, here's all of our contact information. Feel free to email us about any of the content that was mentioned in the presentation. And I am going to see if there's any more questions to be answered.
Yes, thank you all. I know we have only about 1 minute left, although I think we can stay over for a few seconds. And I thank you so much for joining us and all your great questions. I know my colleagues have been answering all of your questions in the Q&A, and I'll just check chat really quickly to see. Don't think
Stephanie, can I answer one question that's a long to type that's in the. So the question is, how will the redetermination process affect billing for providers? And obviously that's a huge concern, and part of the reason why we want to make sure we're getting the word out about this. So if folks are in fact terminated from Medicaid, even if they're terminated when they're still eligible, then if you go to bill for them during that period of termination, you will not be reimbursed. Mercifully, the state is reinstating folks to Medicaid who were terminated but never ineligible in the 90-day period after their termination date. And when they reinstate them, the Medicaid coverage will be retroactive to the termination date. So let's say somebody's terminated in July, gets a health service in August, but actually was ineligible in August. If the person gets back on by completes their redetermination by September 30th, then the state will reinstate them and the healthcare provider can rebill for the August service and be paid. But for folks who are off and stay off, they will not be reimbursable for the period that they're terminated from the program. They'll have to get back on. And if they are trying to get back on after, in that scenario, the September 30th date, in other words, 90 days after their termination, then they'll just have to reapply. Application, you can also get 3 months of retroactive coverage, but if you're not reapplying until December, then you're not going to get retroactive coverage for an August bill. So this is part of the reason why we want to spread the word, is that we understand the pressure that this is going to put on providers to have a bunch of folks who are eligible for Medicaid, but officially off in terms of reimbursement.
Thank you, Carrie. And really quickly, I know that Andrea did address a little bit. We did get some questions about what our wonderful foundation partners can do. And thank you so much for many of them being here and actually hosting this webinar. This webinar alone is one great thing you can do, which is getting the word out, sending Help Hub, the link to the survey, all the resources that we put in our contact information to your grantee organizations and the partners you work with is incredibly helpful for us to get the word out. And we really appreciate everything, and will continue to partner both with foundations, with all of the organizations, and with our state partners, and continue to let you know if there's anything we can think of that you can do to help us even more than you already do.
Thank you, Stephanie, and thank you to everybody. And I know that we're a little bit over time, but to kind of piggyback, this is Julian Lasalde again from the Healthy Communities Foundation, just to piggyback on Stephanie Altman's latest remark regarding not only what funders can do to help support this issue and to get the word out, but what all of us can do to kind of collectively put our heads together. I just want to note that I did include in the chat a few minutes ago a link to the Health and Medicine Policy Research Group is conducting a survey of organizations in Illinois that support Medicaid members. And so they're seeking to survey the Medicaid redetermination landscape in Illinois in order to support efforts to keep as many Illinoisans covered by Medicaid as possible. So the results of this survey are going to be used to improve knowledge sharing and collaboration and advocacy efforts for additional improvements and to support individuals who are going through this process. So if you are able to, please check out the link that was created by our wonderful friends and colleagues over at Michael Reese Health Trust. And please take some time to look at it. We will include this information again in the follow-up email that will be going out shortly after today's webinar. And again, we are about 5 minutes over. We have lost some folks. We're still at about 87 strong. So thank you so much to everybody, to our panelists again from the Shriver Center, Legal Council for Health Justice, and Healthy Illinois Campaign, to all of our partners that attended and participated today, and also, of course, to the organizations, all of you that are doing the work on the ground, have been doing it, and are going to continue to do it. We look forward to staying in touch with you as we move forward. We hope you have a healthy and wonderful day to day, and can enjoy the sunshine that's out today as well. So thank you, and with that, I think we're gonna end for today.
Thank you.